This might sound familiar. Children in the classroom are playing, but one child is off in the corner. Children are playing with toys, but one child is not interested. As the title and the thumbnail already suggests, this video will be on autism spectrum disorders. We will cover all the ins and outs, I will give you some tips and tricks, and we will cover a possible treatment plan. So make sure to watch the whole video so you don't miss any important information. For those of you meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer. This video also comes with a quick disclaimer, it's meant purely informative, this is not medical advice, and when looking for medical advice, always contact your own doctor. And now quickly, let's get started. So as promised, I will start this video by explaining exactly what an autism spectrum disorder is. And as most of you, we can start by Googling it. And if you do so, you will find the following definition. Autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. The disorder also includes limited and repetitive patterns of behavior and communication. As clarification, it is important to note here that the diagnosis with autism spectrum disorder now includes several diagnoses which were previously diagnosed separately, among which an autistic disorder, pervasive developmental disorder not otherwise specified, PDD-NOS, and Asperger syndrome. Which brings us to the DSM-5. This is the most used diagnostic manual to diagnose mental health problems. The DSM-5 specifies the following diagnostic criteria which a person must have in order to be diagnosed with autism spectrum disorder. First of all, there should be persistent deficits in social communication and social interaction. For example, the inability to have a normal back and forth conversation, the inability to initiate or respond to social interactions, poor use of verbal and nonverbal communication, divergent use of eye contact or body language, lack of facial expressions, and difficulties adapting to social context. Secondly, there should also be repetitive patterns of behavior, interests, or activities. For example, repetitive movements, lining up of objects, inflexible adherence to routines, rigid thinking, greeting rituals, strong attachment to unusual objects, apparent indifference to pain or temperature, and adverse responses to specific sounds or textures. Lastly, in order to be diagnosed with an autism spectrum disorder, some of these symptoms should have been present from early childhood. They should also cause a severe dysfunction in someone's personal, social, or occupational functioning, and they should not be able to be explained by another mental health, developmental, or any other disability or disorder. And now you probably want to know, how is autism spectrum disorder caused? Unfortunately, it's not completely known yet, although there seems to be no specific single cause. It's thought to be a problem in someone's brain development, and there are several risk factors which can contribute to the risk of someone developing an autism spectrum disorder. Important risk factors are thought to be having an immediate family member with autism spectrum disorder, having Fragile X syndrome, having other genetic disorders, being conceived by older parents, having a low birth weight, having metabolic problems, exposure to heavy metals or toxins during pregnancy, and exposure to several viral infections during pregnancy. Which brings us to the question, how common is autism spectrum disorder? And research learns us that 1 in 54 children seems to have autism spectrum disorder. It is also reported to occur in all racial, ethnic, and socioeconomic groups. And in all these groups, autism spectrum disorder is more than 4 times more common among boys than among girls. Which brings us to the screening, diagnosis, and treatment of autism spectrum disorder. If you do experience any of the previously mentioned symptoms, or you think that yourself or your child might have an autism spectrum disorder, always discuss this with your personal doctor. Here it may also help to look for early signs of autism spectrum disorder, like avoiding eye contact, having little interest in other children or caretakers, limited display of language, and or getting upset by minor changes in routine. If you do visit your doctor, he or she can help you to find out the extent of your symptoms, provide you with some tips and tricks, and if needed, come up with a treatment plan. Your doctor might do this by asking about your medical history, your current symptoms, the medication you're using, and afterwards your doctor might do a physical examination and some blood tests to rule out any other underlying causes. If necessary, your doctor could then refer you to a specialist in the treatment of autism spectrum disorder, as getting treatment as soon as possible may help preventing your symptoms from worsening. In addition, it can be difficult to diagnose an autism spectrum disorder, as it is diagnosed by assessing someone's developmental history and behavior. Therefore, many children do not receive a final diagnosis until they are much older, and this is done through regular screening and monitoring. Now, before we continue this video, and I will provide you with some tips and tricks and a possible treatment plan, please leave a like and subscribe to my channel, at least if you are learning something and if you are enjoying this video. Now let's continue. Now then, some quick tips to decrease someone's symptoms of an autism spectrum disorder and increase someone's functioning. Try to be consistent, stick to a schedule, reward good behavior, create a home safety zone, make time for fun activities, avoid sensory sensitivities, and do tasks in a series of simple and structured steps. Which brings us to the treatment of autism spectrum disorder. And unfortunately, there is no single treatment which can cure autism spectrum disorder. However, the treatment is aimed at reducing symptoms, improving coping, and maximizing functionality and participation in your social environment. There are many types of treatments available which can help to achieve these goals. Most commonly, the following groups are included: behavioral and communication approaches, dietary approaches, and medication. So let's start with the first group, behavior and communication approaches. And here one of the most used treatment options is cognitive behavioral therapy. Another very commonly used treatment is applied behavioral analysis. This encourages positive behavior and discourages negative behavior to improve a variety of skills. In this treatment, someone's progress is tracked and managed. Other useful treatment options could be occupational therapy, social skills training, and speech therapy. Which brings us to dietary approaches. These are traditionally a part of the treatment of autism spectrum disorder. However, there seems to be very little evidence that dietary changes may help or improve symptoms of autism spectrum disorder. So if you're thinking about changing your child's diet, always discuss this with your personal doctor. Next up, medication. And again, medication cannot cure autism, but it can reduce certain symptoms someone might experience, like high energy levels, inability to focus, anxiety, depression, behavioral reactivity, self-injury, or seizures. When someone is dysfunctioning because of any of these symptoms, then your doctor might prescribe you an antidepressant, antipsychotic, a stimulant, and/or anti-anxiety medication. For those of you that want more information on any of these drugs, I made in-depth videos on most of them, and you can find them in the playlist in the description of this video. Considering the treatment, it's most important that you do discuss this with your own doctor, and you can use the examples I gave you to see if these are suitable for your treatment plan. This was the end of the video. If you have any questions, let me know in the comment section, and I will do my best to answer each and every one of them. I hope you know more now about autism spectrum disorder, because educated people make healthier decisions, which is the whole point of this video and my entire YouTube channel. If you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year. It seems unlikely that I will make it, but you can help me to do this final stretch. Thank you all. Great thanks to my Patreon supporters. Thank you, Sebastian, who is an Investor supporter. For those of you that want to support the channel, consider becoming a Patreon supporter as well. It will help me to make better and more improved videos. And for those of you that can't get enough, I also have an Instagram account @HowToMedicate, posting there a few times a week. Although I have been slacking, my apologies. I will post there very soon, so check it out as well. Thank you all for watching, and I will see you next week with a new video. Bye bye.